How does sports medicine address the demands of specific athletes? Looking at children and young athletes, medical conditions, asthma, diabetes, epilepsy, overuse injuries, thermoregulation, and the appropriateness of resistance training. The Learn 2 from our syllabus looks at the considerations that we need for each of these conditions for children and young athletes, as well as how they can be managed. Asthma is the first medical condition we're going to go through. We know that asthma is going to be a breathing problem caused by sudden or progressive narrowing of the airways, which reduces the amount of air that can get in. An asthma attack can be triggered by a variety of agents, including exercise, allergies, pollens, pollution, and dust. Exercise-induced asthma can occur at the start or during activity, but most of the time it will occur towards the end when the athlete becomes a little bit more fatigued and tired. In relation to our syllabus, making sure we know what the implications are, we need to make sure that the students who is an asthmatic has their puffer with them at all times in case something was to happen during the activity or the sport. Right? And as a coach, we're aware of this. So we know the management, so it's going to be the puffer, and an awareness of which athletes in our team. Right? And the considerations might be that if we know that athletes starting a little bit tired, let them rest. Down the bottom, you'll see here some things to make sure that we note when training for asthmatics would be they have an adequate warm-up. Don't ask them to perform tasks if they are having an attack. Opportunity to rest, as we've previously mentioned. Medication. When their temperatures are hot or cold, make sure we take care. Know their limits and their management techniques. The second medical condition is diabetes. Right, the diabetes is a condition that occurs when the pancreas is unable to produce enough insulin. What happens here is that the athlete's sugar levels will drop, and what will happen will result in fatigue, becoming very lethargic, tired, and disinterested in the activity that they're doing. From a coaching point of view, what's some of the management things that we need to be aware of? We need to know which of our athletes are diabetics. And some of the management techniques we need to be aware of here, that if the athlete does have hypoglycemia, which is low levels of blood sugar level, that we have the appropriate resources to help them out. Resources would be such things as glucose tablets, some lollies, or even sports drinks, which will allow us to then balance out their equilibrium in terms of where their insulin levels would be. If need be, to pull out of the sport or activity and sit down and rest for a period of time and to go and look after themselves and have a drink or have some lollies, by all means they need to be given the permission to do that. The third medical condition is epilepsy. And this is a condition characterised by recurrent seizures. A seizure is caused by an abnormal discharge of electricity activity from the brain. They can also be known as fits or convulsions. From a coaching point of view, some of the management we need to be aware of here is again, we would need to know which of our athletes have the possibility of having an epileptic attack. Some of the things we need to take into consideration: the type of seizure that the child may suffer from, the level of control, and the particular risk from the sport. Epilepsy can be treated with medication, but in the event that the student, during some form of activity, does go through, especially when they get tired and fatigued, does have an epileptic fit, we need to make sure that we allow the epileptic fit to run its course. We don't try and interfere, we don't try and restrain, we don't try and stop the athlete. It's a pretty dangerous time. We need to make sure we clear the area around so there's no chance of them hitting themselves and doing more damage to their body. But when the epileptic fit's finished, of course the child's going to be very, very embarrassed and also going to be very tired because they've had to harness all their energy during this fit. So allow them to rest, put them in a safe place, and obviously call an ambulance if it goes for too long or becomes quite severe. Overuse injuries, and in particular stress fractures, these occur in both pre-adolescent and adolescence and are usually related to the growth imbalances that exist. Our bones can grow faster than muscles or tendons, and as a result of this, pain can result in the lower legs, in particular stress fractures in the shins. Different sports that students or athletes may be playing at a younger age, children, such as gymnastics, dance, or even bowlers in cricket, we need to be aware of these sports because of the back problems that may exist from doing too many overs or bowling the ball too much. All right. Some of the management for overuse injuries can be such as monitoring and varying the frequency of training and competition. Rest is a big one, and a large amount of rest will help decrease overuse injuries. RICA, rest, ice compress, elevate, and referral. Maybe looking at the shoe modifications. The orthotics might be in there to help take a bit of pressure off when they're planting their foot. In severe cases, maybe surgery. and even plaster or a cast to reduce the movement for your overuse injuries. Thermoregulation. This one here looks at, again, talking for the children and young athletes, looking at the control they have over their body temperature. Children are highly susceptible to extremes in temperature as their thermoregulation is less developed than that of an adult. There are three important differences that exist between children and adults. Number one, children have smaller limbs. This means that they have larger skin surface, they have less fluid in their body and more opportunity to lose that fluid through the large skin surface area. Therefore, children are more likely to lose fluid and dehydrate during exercise. The second one being that children have less developed sweat glands than adults. Therefore, they're going to produce less sweat. Because sweating is used to help cool the body down, children are more likely to overheat or suffer from stress or heat-related illnesses. The third one being that children have less muscular development than adults. This means that they are less able to generate heat through muscular activity. So again, making sure that their body's nice and balanced and not overheating. And due to these factors, children are more prone to dehydration and extremes of temperature. So we need to look at our training schedules when we're training, times of the day, making sure water is or adequate supply of water is available for children who, younger children whose bodies aren't as developed as adults. And our last area is being the appropriateness of resistance training. A resistance training program or weight training can help strengthen muscles to prevent injuries from sport. As long as the young athlete is being careful in what they're doing and they've got adequate supervision and they've got people teaching the correct techniques without load or non-weight bearing, then there's no real reason for a risk of injury to occur. The main thing here is that they warm up properly and that their sessions don't last longer than 30 minutes because they're only young children. Their technique must be perfect using very light weights. It's a real good opportunity at young age to teach the correct technique before putting any weight on there at all. Any resistance training using heavy weights is going to cause problems for their body because of the different abnormalities that are still existing within the skeletal system. But again, just finally here from a coaching point of view, making sure they've got an adequate warm-up, knowing that there are no real age guidelines, recommendations for different training programs. Okay, so based on an individual needs here, so one athlete might be able to start a bit earlier than others, while other athletes might need to start a bit later, purely based on their physical capabilities. But if you use a bit of common sense from the coach to manage it and to be aware of it, then that should be fine. Emphasising a warm-up, no weight bearing, and having very good technique and teaching correct technique.